At ASH, again, we have continued progress on the impact of novel therapies, and obviously cellular therapy and immunotherapy, all those are the big topics at ASH this year. In terms of the novel therapy, what's exciting in mantle cell lymphoma, we are seeing a suddenly continuous shift of novel agents that continue to change the landscape as we combine them both in a relapse and potentially frontline setting on ongoing trial. But today at ASH, we actually had, yesterday at ASH, we had the Ibrutinib long-term follow-up of 3.5 years median follow-up of pooled studies. So it's a large number of patients, several hundred patients receiving Ibrutinib as single agent in a relapsed refractory setting. And the lesson that came out of this is that over time the CR rate was up to 26%. But what is also very impressive is that at 3 years, there's still a quarter of the patients that have not progressed, and close to half that are alive. So this is really impressive in patients who are heavily pretreated. And we try to dive deeper into what could help us predict the patient who will do well on Ibrutinib. And it's interesting, although Ibrutinib works in patients regardless of number of prior line therapy in terms of response rate and CR rate, but the duration is clearly affected by the number of prior line therapy. So if you had one prior line therapy versus more than one, there was a significant difference in outcome, both in terms of PFS and duration of response. And if you achieve a complete response at 40 months, I mean, there was the median progression was at 40 months, or was not reached. So this is really powerful data of single agent Ibrutinib in a large group of patients.